After 8 years of this Prime Minister, everything feels broken. Life costs more, work doesn't pay, housing costs have doubled, the Prime Minister divides to control the people. Worst of all, crime and chaos, drugs and disorder rage in our streets. Nowhere is this worse than the opioid overdose crisis that has expanded so dramatically in the last several years. This is a really tough subject, Madam Speaker, and it is very tough when we are challenging what many people thought they knew. Addiction is a ruthless, cold-blooded thief. It is a vile disease that destroys families and lives. It is a disease that preys on its innocent host in unimaginable ways. Addiction will make the victim say and do anything to anyone in order to eliminate the pain. And that is where we need to focus our efforts, Madam Speaker. And that is what our opposition motion today does. Instead of putting a Band-Aid on the gushing wound, Conservatives are saying, let's treat the trauma, let's destroy the predator and save the host. Conservatives are calling on the Liberals to redirect their taxpayer money of safe supply into treatment and recovery and bring our loved ones home. Conservatives are asking to understand why, to invest in understanding why, and to fund recovery. Conservatives want to give people suffering with addiction back their life, their family, and their body. I believe Safe Supply is one of the most powerful marketing campaigns ever released. Let's be honest. If someone you loved had a life-threatening disease, you would buy or agree to anything that would keep them alive. You wouldn't ask questions. You would just hear it, that it would keep them alive, and you would sign the dotted line. The idea of Safe Supply has sold a whole culture of people a falsehood, a hope that they will save your loved one. But the reality is, Safe Supply just keeps them where they are. It allows addiction to continue to prey on its innocent host. And honestly, it's a hell of a business model. Why not keep your customer coming back for more? There is a distinct difference between OAT and Safe Supply, and it is critical that everyone watching listens to the difference. Because once they do, I believe they will understand that Conservatives are the only party offering a compassionate solution to the biggest crisis our country has ever suffered. Evidence-based medication refers to opioid agonist therapy, OAT. It includes drugs such as Suboxone, Sublocade, and Methadone. This is different than Canada's Safe Supply, which includes drugs like hydromorphone. Hydromorphone is equivalent to heroin. OAT is a recovery-oriented therapy which addresses the torturous, sometimes deadly withdrawal symptoms that opioid addicts experience when they stop using their drugs. And these symptoms are a major barrier to recovery if left untreated. I highly recommend everyone watch Dope Sick. It is one of the best public education tools out there to understand this. I have many friends who have lived a full life and live a full life in recovery thanks to OAT. With OAT, those in recovery are given long-lasting, milder opioids that stave off withdrawal without providing any high or euphoria, helping patients live free of narcotic impairment. The administration of OAT is tightly controlled. Patients generally must come to a clinic every day for supervised consumption. Take-home use is strictly monitored. In contrast to OAT, Safe Supply drugs are intended to mimic the highs of illicit substance use, not manage withdrawal. Safer Supply doesn't move patients toward a drug-free life. It is, in theory, intended to prevent overdoses and death until one is ready to begin their recovery journey. So many people who are not on board with our solutions will tell you that it is the deadly supply of fentanyl on the streets that is killing the people. And they are absolutely correct. But guess how those dealing with addiction are getting that deadly, toxic dose of fentanyl? Because they are selling their government-funded Safe Supply. Why are they selling their government-funded Safe Supply? Because they need a stronger high. Never before have we had such powerful drugs. The physiological dependence on these drugs cannot be understated, Madam Speaker. It turns out that hydromorphone is too weak to get fentanyl users high, and for this reason, many safer supply recipients simply sell or divert their government-provided hydromorphone on the street at rock-bottom prices to purchase more street fentanyl. Safer supply doesn't dissuade illicit fentanyl consumption, it subsidizes it. That is a direct quote from Adam Zivo from the National Post. The type of studies they, safer supply advocates, are doing are the weakest. The bottom line is they're not comparing. That is the unethical part. They're not comparing hydromorphone programs to the standard of care, which is methadone. That would be more ethical. That's Dr. Lori Regenstreif. It's very common for my patients to tell me that they know people who sold most, if not all, of their prescriptions for public supply of addictive drugs. Unfortunately, that means that hydromorphone is going somewhere else. Dr. Vincent Lamb. So how do we prevent overdoses? We must invest in prevention, naloxone, and we must invest in programs that treat the why in addiction. Until the person who is addicted understands why they are using, they will never be free. Until the person has the support they need, they are stuck. Conservatives are asking this House, they are asking and demanding the Liberals redirect funding of safe supply to treatment and recovery. Canada is in the midst of an opioid crisis that has killed over 35,000 people since 2016. And that number doesn't account for the collateral damage that addiction leaves for families. How many kids are traumatized because their parent is stuck in the grips of addiction or has lost a parent, a sister, a mother, a daughter, a brother, an aunt to addiction? Since 2017, the federal government has spent over $800 million on its failed Canadian drugs and substances strategies, including over $100 million in funding for hard drug supply projects across Canada, and plans to spend an additional $74 million to scale up these projects over the next 5 years. Since tax-funded drug supply was ramped up in 2020, opioid deaths have only gone up. According to Public Health Agency of Canada, in 2021, more than 8,000 people died of opioid overdoses, while less than 3,000 died of overdoses in 2016. It is not working. How much time do I have, Madam Speaker? I just can't explain a more horrible disease than addiction. I just can't. There are parents at home right now who are waiting for a phone call because they had a bright, amazing child, and maybe that child got hurt and they got prescribed opioids. Maybe they have trauma and they use drugs to escape the pain, and they're waiting for a phone call that their child has died. Imagine if the Liberals committed to spending $800 million on treatment and recovery instead of drugs that are funding drug dealers. I know this is hard, Madam Speaker. So many people got sold an idea and it was wrong. Again, we see an example of this government spending money in all the wrong places. The path out of addiction takes full commitment, and access to treatment and recovery must be available instantly. Seconds matter, and we need housing away from the life that will not put them back where they were, and we need to invest in prevention. Mentally healthy, resilient kids turn into mentally healthy, resilient adults. Treating the problem with the problem is not a solution. Safe supply is killing our children. The data is in, overdoses are up 300%. Today, the Conservatives are asking the House call on the government to immediately reverse its deadly policies and redirect all funds from taxpayer-funded hard drug programs to addiction, treatment, and recovery programs. Let's be leaders and invest in recovery and treatment, and let's bring everyone's children home safely. Thank you, Madam Speaker.
Questions and comments. The Honourable Parliamentary Secretary to the Minister of Natural Resources.
Thank you, Madam Speaker. And look, I will agree with the member opposite that there is much more beyond prescribed harm reduction to resolve these issues that we're facing with the opioid crisis. But where I disagree is that the British Columbia Coroner's Office specifically stated, and I quote, "There is no indication that prescribed safe supply is contributing to illicit drug deaths." Now that's the coroner, the British Columbia's coroner that said that. So how does a member opposite respond to that fact from what I would think is a respected source?
Member for Peterborough Quarter.
Again, the stats speak for themselves, Madam Speaker, but I really think it's really important. Overdoses are up 300%. That's just the reality of it. I really want to touch on a point that's critical, and that is the fear that has been instilled in experts who are on the ground. And I'm going to read something from somebody who's worked for 3 decades in treatment and recovery. I have to agree with the leader 100%, and this person, for the record, is not a conservative at all. And this person goes on to say, but for people speaking out against it, you become vilified, like we don't care about people. Hydromorphone doesn't even come close to the strength of fentanyl. I had one young fellow tell me, if someone dies from an overdose, people are trying to find out who the dealer is so they can purchase from them because of the strength. We are just throwing...
I have to give the same time for the question and the answer. Questions et commentaires, l'honorable député de Beauport-Limoilou.
The honourable member for Beauport-Limoilou. Thank you, Madam Speaker. I'd like to come back to what my colleague was reading from. I think it's important to have a holistic, comprehensive view of the situation in order to be able to support people with addictions and help them get out of those addictions. And so we need to deal with the black market and dealers and so on. So I'd like my colleague's opinion on the importance of investing in mental health and supports for addicts and investments to fight the black market.
Thank you, Madam Speaker. That is such a great question because it's exactly what we're saying, and that's why we really hope we get the Bloc's support on this. Imagine we redirected the funds that are going into funding drug dealers, because that's ultimately what Safe Supply is doing, and put it into mental health supports. There is a mental health commission report from 2016. Do you know how much has been done on that? Nothing. Nothing. We have people with mental disorders living on the streets. Why? Because we have nothing from this government to help people with mental disorders and addiction. That's the reality. That is what we're asking for today, Madam Speaker.
Yeah.
The honourable member for Courtney Alberni.
What the Conservative motion today would do is everybody would have to go to the street that uses drugs. So they would get unregulated toxic drugs, which are flooding our streets, Madam Speaker. It's not Safe Supply that's killing people. Safe Supply is still in its infancy. Very few people are on it or can even access it, Madam Speaker. Now, again, I want to go back to the OAT and the Safe Supply conversation. I really appreciated her talking about that because OAT is critical, absolutely essential. But people that it's not strong enough, Madam Speaker, they're going to the street to top up. This is where we need to have Safe Supply work with OAT in cohesion. But also, Madam Speaker, this is supported by the police chiefs of Canada. This is supported by Gwen Boniface, the former OPP police chief who's got a bill in the Senate. This is supported by the Vancouver Police who called out the leader of the Conservative Party this morning in the Globe and Mail for misinformation. Why are they railing against the police when they're the tough on crime party?
Honourable member for Peterborough Kawartha.
I hope my colleague votes in favor of this today because I know how much he cares about this. Dr. Koivu said that several patients, this is a doctor who was a massive advocate for Safe Supply, said that several patients voluntarily left their homes to move into tents located in a parking lot near a pharmacy that dispenses Safer Supply drugs. They wanted to be close to the action, to buy hydromorphone early in the morning when it was the cheapest on the black market for consumption and profitable resale. She is now convinced that Safer Supply exasperates homelessness. If this House, if the NDP and the Liberals care about homelessness, mental health, and helping people, then vote in support of this motion.
Resuming debate, reprise du débat, l'honorable député de London.
The honourable member for London West.
Bonjour, Madame la